Hello, my name is Jeremy. I'm with Faithful Guardian Training Center, and today we're going to be talking about med legal. This first part, we're going to be talking about the standard of care, protocols, negligence, things like that. So the standard of care is the way that you're required to act as a EMT, as an advanced EMT, as a paramedic. It essentially looks at yourself, how you act, and how others in a similar position, who have similar training, of a similar background, would act, again, in that same situation. And that a way that we control that is by establishing a national scope of practice. And so this gets into what EMTs are allowed to do, advanced EMTs are allowed to do, paramedics are allowed to do, and recognizing the why and the when of all these events. And a way that this is helped established is also going to be through your protocols and your standing orders. So protocols and standing orders, those are the guidelines that you're allowed to operate off of, and those are given to you by your medical director at a local level for the service that you work for. And that's going to help determine the standard of care that you can provide. And a way that your protocols are looked at is based off what you're allowed to do, so your scope of practice. So to get your scope of practice, you have two different levels. You have two different types. You have your certification, and then you have your licensure. Your certification is going to be, for example, National Registry. That is what you are allowed to do, or what you have the knowledge to do, what you have the skills to do, and you have proven competency through a program that has checked you off on all these skills to a national standard. That national standard of care. Now, a licensure is what actually allows you to perform those skills, perform those activities. For example, if you have an EMT that has an EMT licensure and they have their EMT certification, they have passed the test to show that they are a competent EMT, and the state has deemed that certification adequate proof that they should be allowed to operate at that level, EMT. Now, EMTs are not allowed to do IVs. They're not allowed to drop advanced airways such as endotracheal tubes, supraglottic airways, perform manual defibrillation, and things like that. If you have that EMT and they go through paramedic school to become a paramedic, well, that gets them eligible to take the test for their national certification for their paramedic. Now, that EMT who has never been allowed to do IVs, never been allowed to intubate, they perform those activities in paramedic school when they're acting as a paramedic student. Now, this same person, they pass their test and they get their paramedic certification, which makes them eligible to get their paramedic licensure. But if they do not get their paramedic licensure, they maintain their EMT licensure and their paramedic certification. What this is doing is this is not allowing the provider to be able to act as a paramedic in the eyes of the state. So, for example, even though they have the skills and they have the training, they are not allowed to do it because they are not licensed by the state. And that is the big difference between an EMT and a paramedic and the certification and the licensure. Part of your what we're required to do in the med legal aspect is going to be our duty to act. Our duty to act is essentially, if we're on shift, we are required to perform emergency activities. We're required to respond to calls. We're required to respond and deliver a standard of care to all patients that we come in contact with. That is your responsibility to provide patient care. Now, part of your duty to act is if you breach it in any way, it can cause legal repercussions. And the way that they do this is it's actually called gross negligence. So the way that the things that are required for gross negligence to be established is going to be you have to have a duty to act. So you had to have been on shift. You had to have a responsibility to perform emergency activities. Next up, you'll have your damages. So what sort of damages or injuries occurred during this event? Right? And then you have your breach of duty, or I'm sorry, your causation. So causation is, what did you do to cause those damages during whatever instance this is. And then next they have their breach of duty. So for example, if you perform an IO and you miss and you deliver a whole bunch of fluids through it, what's going to happen is that could be established as a breach of duty because you broke your standard of care by not verifying IO placement. And the damages that were caused could have been your patient dying. And the causation would be the missed IO to the damages to your patient dying. Doesn't necessarily mean that you breached your duty, but those things are required to be established for gross negligence to be established and to be tried. Next, we have consent. So consent is broken down to a couple different ways. You have implied consent, you have express consent, you have informed consent, and they each have their own little nuances. Now consent, that is essentially what one person is allowing for another to perform on them. So for example, if I need to do an IV, I need to let you know that I need to do an IV. If I need to put you on the monitor, I need to tell you that I need to put you on the monitor. And you can say, it's okay if you can put me on the monitor. Well, that gives me your consent. And what that's doing is, if I say, hey, they're like, why? Why do I need to be put on the monitor? I say, hey, I need to put you on the monitor that way I can get a good look at your heart to figure out, help figure out what's going on. And that's going to be part of that informed consent. If you need to get an IV on somebody, you need to say, hey, can I get an IV on you? This is going to allow us to give some medications, or the hospital to draw blood, whatever based off your protocols you're supposed to do in those situations. And that's going to be that informed consent. Your patient can consent to any aspect of care or none of it. They can say, I just need a ride to the hospital, and they consent to you putting them in the back of the ambulance. They consent to you getting them onto the stretcher, but they do not consent to the cardiac monitor. They do not consent to the IV. Now, if you have somebody that says, hey, I need to get a blood pressure on you, and they throw their arm out at you, and in semblance of, hey, put the blood pressure cuff on my arm, that can be established as expressed consent because they made an expression that would allow them or allow you to perform an action on them. Next, you have implied consent. Implied consent, that works in people who are not of sound mind and body or who are not adults. So for example, if you have somebody who's unconscious, unresponsive on the side of the road and they wake up and they're like, well, I didn't want to go to the hospital, I was just taking a nap or something like that. Well, what's going to happen is you were operating under implied consent at the time if you could not get them to wake up. Reason being is, what would a person of sound mind and body want performed for them? They would want the life-saving measures performed on them to sustain their life. And that's what we're operating under whenever we do implied consent. Again, they're not of sound mind and body. And that implied consent also works in the case of pediatrics, who they do not have an adult nearby or around to be able to consent to care. And so you are operating under implied consent. What would a rational adult under similar circumstances want performed? Would they want life-saving measures performed on their child? Would they want their child transported to the emergency department for continuity of care? These are all things that we have to look at. And this is going to be the conclusion of the first part of the Med Legal.